And we continue our coverage of the coronavirus outbreak with Dr. Mohammed Oz. Dr. Oz, good morning to you. I know you spoke to a colleague who was invited by the Chinese government to go over there, help try to figure out how to contain this virus. What did he have to say when he returned? Does he think they're doing enough?
Well, he thinks they're doing enough. It was very provocative to speak with him. His name is Ian Lipkin. He's the famed virus hunter. The movie Contagion, you may remember, was based in part on his character.
Oh.
And he's been involved in all these different outbreaks, so I trust his judgment. He's at Columbia University with me. He's currently quarantined, so I had to talk to him via Zoom. But the big breakdown is the following. One, this is a much more contagious virus than we initially appreciated. For everyone who gets this virus, 2.2 people will get it, the illness as well. That's compared to 1.3 people getting the flu if you have the flu. So it's a lot more contagious than even the regular old flu. And the reason that's important is because it means, and this stunned me, that this virus will probably become endemic, which means it won't burn out by itself. It's going to be part of our communities for the foreseeable future, which makes the creation of a vaccine imperative. Now, it's not as deadly a virus as SARS, but because it spreads so rapidly, you don't want to get it. And, people will die and they'll be sick in the meantime. So we want to make sure we make a vaccine program that's effective. There's work being done in Texas. There's work being done in Washington. There's many centers focused on this. And I'm visiting some of these facilities. If we can get a vaccine out in the next 3 months that works, then we can get it to the population within the next 6 to 9 months. And that timing would work out well because these viruses tend to do better in the winter months. So if it sort of slows down the summer and gives us a little breathing room, by the time it comes back and hits us in force next winter, this country will be prepared.
Yeah, we have an inside look at the labs at the National Institute of Health where they're working on trying to stop this, trying to develop a vaccine. How far do you think we are off from a vaccine?
Well, Lauren, I spoke to these different groups. The best estimates are about 3 months. And then we're going to get federal permission to move more rapidly so they can do the testing quickly. You don't want to rush it and miss your target, nor do you want to make a dangerous vaccine. But I'm hopeful that these wonderful people are working as hard as they can. And by the way, it's also happening in other countries. The Chinese, believe me, are working hard to make vaccines. But I'll tell you, there's a bigger issue here, Lauren. The bigger lesson, we need to have a more aggressive, rapid response to these outbreaks. It cannot be slowed down for a variety of reasons. And the fact that this got out of Wuhan so rapidly and now it's affecting the rest of the world and the entire country of China in particular is the demonstration, a real case of it not being aggressively addressed.
Right.
Next time one of these viruses hits us, and there will be more, we need to have a more organized response.
Yeah. Does Dr. Lipkin think that China delayed in reporting it? And how long until he thinks it's on our front doorstep?
It's hard to tell if it was delayed. In the fog of war, it seemed like even the scientists were confused about whether this was real or not. But it needs to, next time, not, for whatever reason, be delayed. And it's already coming to our doorsteps. I don't think we're going to have a crisis here in the near future. Dr. Lipkin's very calming in saying it's thankfully not a deadly virus if you're already healthy. But part of the reason it was so devastating in China was because once it got into a hospital, it spread to everybody in the hospital. There's a big article yesterday in one of our biggest medical journals underlining what Dr. Lipkin's saying, which is that in the first hospital, 40% of the people who had the virus were already there before the virus got there.
Right.
So you're already in the ICU struggling with a bad operation, and now you got a virus on top of that. So we want to avoid those issues, and we don't want the healthcare professionals getting sick too, because then you break down the healthcare system.
Good point. Good point. Thank you so much for your insight. We appreciate it.
You're welcome, Lauren.
And you can see Dr. Oz weekdays at 2 right here on Fox 4.